State legislators are responding to the pandemic by advocating for local communities struggling with everything from health concerns to economic distress and spotty connections to remote learning. Among those pressing for more attention to needs in Boston is the state senator from the 2nd Suffolk District, which includes Roxbury and Jamaica Plain. We'd like to welcome Sonia Chang-Díaz. Thank you very much for being with us, Senator.
Thanks for having me, Chris.
So I want to start with one thing that a lot of us in Boston have our eye on, and that is the disparities in the impact of COVID-19. You trying to do something about that in the state legislature. What would you like to see happen?
Yeah, I mean, there are several layers of things that need to happen. There's no one silver bullet here, but I'm sorry, I just want to silence my devices. But I think the starting block for getting this right is making sure that we have robust data that is really a cornerstone for government. The transparency and accountability is a cornerstone for a healthy and appropriate and informed government response to any crisis. And we know already from the sort of broad strokes of data that we have been able to accumulate for the first few months of this pandemic that there are deep and wide disparities, as you referenced, economic disparities, racial disparities, ethnic disparities, disparities between immigrant communities and non-immigrant communities in who is bearing the fullest brunt of this pandemic in both infection rates, hospitalizations, death rates, and also the economic impact. And so making sure that we are really drilling down, getting more complete data that can guide the government's response, but then not just stopping at having a full picture of what's going on, but then really using that data to drive action in the government's response. And so that's something that I've been working on, as well as many colleagues in the State House. I know Congresswoman Presley on the federal level and Senator Warren have been carrying that banner. And I'm really happy to report that just yesterday, or this Thursday of this week, we got a really strong bill passed through both the House and the Senate in final passage, and now it's onto the governor's desk, that does all of those things, robust data collection, and also calls very specifically for the governor to articulate what action steps the executive branch will be taking to respond to those disparities and mitigate them, and also puts in place an advisory task force for the legislature to make fast recommendations to the legislature about what additional response we should be taking in addition to the executive branch.
From the data we have already, we can see elevated infection rates in neighborhoods like East Boston or even Hyde Park. I don't know why those neighborhoods they might have different reasons for that as well. But what's missing? What do we need to know, and what do we need to know sooner?
Yeah. So, it's true. Broad strokes, we know what the disparities are, and honestly, we could have predicted these from a mile away, right, from the first day of the state of emergency, and we should have done better at being ahead of that curve. What is missing from the data is more granular things. For example, collecting data on what language people speak who are catching at any point in the system. So we're seeing if there are sort of more specific pockets. We know that immigrants, generally speaking, are facing, a much heavier toll, but are there subgroups within, the moniker of immigrant, right, that are suffering more or less? Also, occupation is another piece of information that this data bill includes to see, where are there patterns that we haven't yet discerned that we can discern with more data about what kinds of frontline workers are most at risk right now, or have been least provided for in terms of PPE and safety standards. And then there's also the question of just making sure that we have actually complete data in the categories that we, in theory, have already been collecting. We can see from the available data that there are these deep and wide racial and ethnic disparities. There's actually a ton of data missing. There are a lot of instances of a positive COVID test or hospitalization where there just is no data that was reported in terms of what was the race or ethnicity of that individual, where do they come from, where do they live in Massachusetts. So making sure that we're getting more complete data also in those categories.
Well, data also means things that individuals and businesses need to know for a safe reopening. How do you feel about what's in place at this point?
In terms of the reopening?
Right, in terms of things that might have to come from testing and quick access to testing.
Well, I mean, I think that testing is my biggest category of worry in terms of the metrics that we're tracking right now as a state on our sort of big picture dashboard that's guiding reopening. We're looking at things like what is the overall infection rate in our state? What is the positive rate among all people who have been tested? How much sort of spare headroom do we have in our emergency rooms and our ICUs in Massachusetts? All really important metrics, but our testing rate, our positive rate in terms of all people tested is where I think we really need to grow our capacity because we're just not testing enough people right now in order to have a clear picture of where transmission is happening, where we really need to sort of go hard and go deep in order to get to try and race ahead of the virus. So that's my biggest concern in terms of reopening is testing capacity. I will also say there are things that we need to do more in terms of building up our systems for responding to the sort of long rebuild here and the potential for another possible round of infection. We have, for example, one of the strongest laws that we put in place. This was something that we did in the legislature that I'm very proud of, that in part deals with the issue of disparities, which was a housing stabilization bill to put in place a moratorium on all evictions and foreclosures in the state, which I believe extends through August. Now, that feels like a long time away in COVID time, right? Because each week feels like a few months, but that's going to be here before we know it. And we are not going to be back to normal as a state in August, and our economy is not going to be back to normal, and not everybody is going to be back to work in August. So making sure that we have systems in place to either extend that moratorium or that we have assistance programs that are more beefed up in order to be able to help folks be able to make rent, not get evicted, and become housing insecure in addition, which puts them at a greater risk for exposure to COVID-19.
Well, you're talking about things that even the governor cannot do unilaterally. That means the legislature has to be able to make it happen. And ordinarily you'd go to the State House and you'd do that, but you can't go to the State House and be over there at the same time. So how are you going to make this work?
Well, just the same way you and I are making it work right now, Chris. This is a place where a lot of institutions in our society have figured out how to put in place alternative systems for carrying on the work of that institution, in this case government. Government is an essential function in a crisis. The legislative branch controls or should control. We have a constitutional duty to manage the purse strings, know where the money is going and where it's being spent, and also to be able to take difficult decisions. And right now our legislature is operating on a what's called an informal session basis, which means that there are a few people who show up in the House chamber, the Senate chamber, to just sort of move the paperwork and do the sort of official saying of words around votes. But it means that no legislation that is controversial to anyone can move forward. If any one person objects, that legislation cannot move forward. And the whole point of having a representative legislative body is that when it's time to make tough decisions on things that people tend to disagree on, right? That we show up and we vote and we count the heads and we move forward with those decisions so that we're not paralyzed with inaction. But if we're operating on a by consensus only model, which is what we're doing right now, where we can't move forward with anything if any one person objects, that means really important action steps are being left undone in our Commonwealth. And that's particularly impactful, again, for those communities who are bearing the disproportionate brunt of COVID-19. It's not going to be by consensus that we take important decisions like how to help Chelsea, right? How to help Brockton, how to help East Boston. Not everyone is going to agree on the best way to do that, but that doesn't excuse us from doing anything at all. And so we need to be able to stand up systems that allow legislators to show up on a, whether it's Zoom or another platform, to show up on a digital platform and carry on debate like we used to do when we were in a room together. And I think the tools exist for us to do this. Many other legislatures across the nation have figured out how to do it. And this is something I'm pushing hard for here in Massachusetts.
Well, one thing you pushed hard for over a number of years is doing something about educational disparities or the achievement gap, the funding gap. What about what you see now with students here in Boston, for example, struggling to plug into remote learning?
Yeah. Well, again, it's another example where school systems across our Commonwealth are having to figure this out. And, there's a lot of iteration going on. There's a lot of trial and error and experimentation. But what I appreciate is that I see, at least from my vantage point as a BPS parent, is that I see the school system trying things, right? And, they're getting better every week. And I would like to see the legislature step up with that same level of innovative spirit and sort of resolve to solve the problem. But where schools are concerned, man, it is a huge mountain of work that our school systems have to figure out how to deliver all of that academic content, all of the social emotional content. And wraparound services, in the context of this crisis. And I really just want to take my hat off to the folks that have been working around the clock to figure out new ways to do that for our school system. The work is certainly not over. I think none of us really know what September and October and on are going to look like. But I at least see folks out there sort of in the digital trenches working on that innovation and experimentation to try and make it happen. And for my part in the legislature, I will continue to fight, and many of my colleagues are continuing to fight to make sure that the dollars are there to support our school systems as they are undertaking this enormous lift to continue teaching our children even amidst this crisis.
Well, in the short term, I think a lot fewer dollars are going to be there for the state. Anything you think that should be done to get around that to some degree? You mean new revenue or just maybe scaling some things back?
Yeah, you said it, Chris. I'm so glad that you asked that question because I think that is one of the most important debates that we need to have. And again, we need to be meeting digitally in order to have it, is to have a real frank conversation about how we are going to tackle the enormous hole that will exist in our state budget for the coming year if we don't do anything significantly different. You said it. I think that means revenue reform. And, I know there's sort of a general sort of instinct against changing tax policy during an economic downturn. But there are legions of economists, both nationally and here in our state that affirm that that's actually the exact wrong approach during an economic downturn, that it's really the government has a special role to be able to juice the economy, by putting dollars out there onto the street, make sure that that money is continuing to circulate, and that we are not compounding the pain and the devastation that our communities are feeling because of this virus and because of the loss of work by really cutting profoundly deeply into our core services like education, like public safety, like our healthcare system, like our judicial system. These are things that people rely on. They are mission critical in our society. And so the other alternative, if we're not going to cut those things, is that we need to talk about revenue. And I'll tell you, Chris, a lot of people aren't making money right now, but there are some corporations that are making gobs of money during this pandemic. And I personally I'm not afraid of that conversation to say, look, if you are making windfall profits because of this pandemic, and good for you if you're providing a service, again, like Zoom, right, that we all need. But if you are making windfall profits, then you need to give something back, right, to help the whole of our society make it through this crisis.